When I was in school, I was taught that contents of air are oxygen, nitrogen, and some inert gases. Unfortunately, these days, when children are taught about contents of air, they are taught about particulate matter or PM, which is divided into 10, 2.5, and 1 according to its micron size, and various gases which are there as pollutants range from carbon dioxide, SOx, NOx, monoxide, various other things, including ozone. And these, unfortunately, are increasing in amount continuously. So levels of 6 major pollutants are put together into an algorithm to reach the amount of the level of toxicity, overall toxicity of that air. And this number is ranging from 0 to 300 plus, 0 to 50 on the left-hand side being good. That 75 to 85 or even more than that is something which is present in almost the whole of our country. More than 95% surface area of the country actually has bad air. So it's wrong to say that it's a problem confined to Delhi. Because of being capital, Delhi tends to get more attention. Hardly any organ in the body which is not adversely impacted by air pollution. So it's a wrong notion that people have that at worst air pollution only affects our lungs. Most of the people I speak to, including large number of doctors, believe that air pollution only impacts or harms lungs. The fact is, it harms our brain, including the brain of growing young children. It harms our heart, causes higher incidence of hypertension and heart attacks. It impacts lungs, where of course it causes large number of diseases. It also impacts pancreas, which is now being considered to be responsible for rising incidence of diabetes in India, which is making India the diabetes capital of the world. And it is also affecting bone, blood, and joints, leading to higher incidence of these problems. In fact, what is happening is that every year there is more and more research emerging, which is contributing, which is alleging pollution to be a cause of an increasing number of diseases, which were earlier attributed to different causes. Air pollution is a national health emergency, and we in Lung Care Foundation have this AAA approach that let's make people aware. When they are aware, they will be awakened, and when they are awakened, they will definitely take actions towards solving this problem. Pollution impacted communities, pollution impacted areas are reporting much higher per population incidence of COVID. What is incidence? Incidence is number of cases per unit population. This was the startling revelation which came out of the Harvard study, which said that if you are living in an area with high PM 2.5, the impact of pollution, people talk in terms of death, but death is only the tip of the pyramid. Before a person dies, from the normal person stage to death, there is a huge distance that he travels. When he falls sick, he gets admitted, he goes to hospitals, his family is disturbed, he is disturbed, there is absenteeism from office of himself and the family members. And the cost of all that to the economy is far more than the cost of solving this problem and not letting that happen. There are two options that we have. Either we sit back and continue our business as usual. Oh, hum kya kar sakte hain? What can we do? Or we take notice of it that it's not us who are getting affected. It's our next generation which is getting affected. And how can we let our next generation be destroyed by the impact of what our forefathers had done and what we are continuing to do today? So we respond to this national health emergency and do everything that it takes to achieve clean air, which I think is a fundamental human right. Choice is yours.